Anterior cervical discectomy and fusion is the name of the spine surgery for the neck pain in cervical spondylosis. It is also called as ACDF. In future part of video, we'll address as ACDF surgery only. Today we'll discuss the indications in which patients we do anterior cervical discectomy and fusion, how to do it, what are the risks involved, and what is the outcome. Anterior cervical discectomy and fusion is performed in patients with a neck pain which radiates to their hand or upper back. They may present with numbness or weakness in the hands, unable to lift their shoulder, or they may feel imbalance while walking. Most of these patients will get benefit from medical line of treatment, rest and physiotherapy. Only 10% of the patients who are not benefited by medicines need this surgery called as anterior cervical discectomy and fusion. The procedure is performed by an expert neurosurgeon or spine surgeon trained in microscopic surgery for cervical spine. The doctor confirms the diagnosis of cervical spondylosis. He performs a MRI scan of your neck to look for a slip disc or a disc osteophyte complex compressing your cervical spinal cord. Once surgery is planned, you will be advised to do some blood tests, some chest x-rays, ECGs to know your fitness for general anesthesia. This surgery is performed under general anesthesia. An anesthetist will evaluate all your blood tests, chest x-ray and ECG and give fitness for surgery. Once you are fit for surgery, you will be asked for admission to the hospital. In addition to this, the doctor will ask what all medications you are on before the surgery. A list of medication you have to bring to the hospital before a doctor performs the surgery. Some medicines like blood thinners should be stopped 7 days before the planned surgery. Once you are admitted to the hospital, your doctor will write the medicines required for the surgery on the next day. You will be asked to be fasting for at least 12 hours before the procedure. You have to take a good head shower with an antiseptic solution a day before the surgery. In the morning of the surgery, doctor will prescribe some antibiotic and analgesics. Should not take anything by mouth until we finish the surgery. The nursing staff will shift you to the operation theatre. They will send all your MRI scan finding, blood reports along with you to the operation theatre. You will be shifted to operation theatre 1 hour prior to the planned time of the surgery. The surgery is performed under general anesthesia where you will not be aware of the surgery performed. You will be made to lie straight on the bed with a support for your head, and a small opening is made on the front of your neck. The operation is performed with the help of a microscope. We use tiny micro instruments to navigate through the neck to the cervical spine area. We confirm the area of the disc involved with the help of intraoperative fluoroscopy or a X-ray. Once the involved disc has been confirmed on CR, we do a discectomy under the microscopic guidance and will free the cervical spinal cord and the nerve involved. At the end of the procedure, once the hemostasis is achieved, a small tube is placed in front of the neck. The wound is closed with the absorptive sutures. After the surgery, you will stay in OT recovery room for at least 1 to 2 hours. There we will observe you for the fluctuation in the blood pressure or heart rate or any change in your respiration. The duration of surgery is almost 2 to 3 hours. After surgery, you will be asked to do fasting for at least 4 hours. Meanwhile, your pain is controlled with the medicines which are given through injections. 1 hour after the observation in the recovery room, you will be shifted to ward. In the ward, you will rest for another 4 hours. After 4 hours, you will be allowed to drink water and then to take semi-solid foods. Once your blood pressure, heart rate are stable and you are comfortable, a physiotherapist will help you to walk inside the room. Once you are comfortable walking, on your own you can sit on a chair, watch a TV or go to washroom. There will be a catheter for urination for at least 24 hours. After 24 hours, the urine catheter will be removed and you will be made to walk independently. Most of the patients after anterior cervical discectomy and fusion surgery are discharged within 24 hours after the surgery. The most common complaint the patient have after ACDF surgery is difficulty in swallowing, because during surgery we retract the food pipe in the neck, so you might complain of a sore throat at least for a week after the cervical spine surgery. Normally it resolves within 1 week and you are advised to take warm water, warm food and avoid any cold food. The other side effect few people have is hoarseness of a voice. It is less than 0.5% people who will suffer from the hoarseness of voice. At the time of discharge, the doctor will explain you what things you should do and what things you should not do. You should wear a neck collar for at least 6 weeks to 12 weeks after the cervical spine surgery, and you have to continue wearing this collar for at least 10 to 12 weeks after surgery. You can remove the collar while you are sleeping, but whenever you are sitting, standing, traveling or walking or driving a car, you should wear a cervical collar. After surgery, you should not bend your neck, rotate or turn your neck for at least 10 weeks after the surgery. You should not lift any weight more than 5 pounds for at least 6 weeks after the spine surgery. You should not drive a 4-wheeler or 2-wheeler at least for a month after cervical spine surgery. You were asked not to take bath at least for 10 days after the cervical spine surgery. Normally the sutures are absorbable and they fall on their own. There is no need to remove the suture. But the suture site or the wound site or operation site has to be reviewed by your doctor 2 weeks after the spine surgery. You should call your doctor if you have a fever more than 101.5 degree, you have a rash at the operative site, if you feel severe pain or discharge at the operative site, or you suffer from hand pain or numbness. Anterior cervical discectomy and fusion surgery for cervical spondylosis is effective in more than 90 to 95% of the patient with neck pain as well as hand pain.